A recent study reported that a staggering 1 in 4 people who underwent knee replacement surgery did not have their expectations met and were dissatisfied with surgery. And with so many patients not fully satisfied, it begs the question, what's causing this dissatisfaction and what are the key expectations that must be met to increase the chances of a positive outcome? In this video, we'll deep dive into the differences in outcomes between satisfied and unsatisfied patients after a knee replacement surgery. Together, we'll uncover the crucial expectations that were not met and therefore contributed to dissatisfaction. The goal is to provide you with valuable information that can assist you in determining whether a total knee arthroplasty is the right solution for your unique set of symptoms. Hey everyone, Dr. Jeff Peng here. A knee replacement is often seen as a last resort for patients with end-stage arthritis of the knee. Patients go into surgery with very different expectations that go well beyond just pain relief and functional improvement. Multiple studies have reported that patient expectations play a significant role in the decision-making process for a knee replacement surgery, and the extent to which they are met can impact post-operative outcomes as well as satisfaction. Other studies have shown that unfulfilled expectations are a major contributor to patient dissatisfaction. So the question now is, what are some of the most important expectations that must be met for patients undergoing knee replacement surgery? This recent study wanted to answer that question. They reported data from 352 patients, all who underwent total knee arthroplasty. Patients were given a set of outcome measures as well as a questionnaire regarding their expectations before undergoing surgery. The questionnaire consisted of 31 items reflecting symptoms, physical function, physical activity, quality of life, coping strategies, and activities of daily life. Patients were asked to rate the personal importance of these items in terms of a successful surgery, with possible answers being mandatory, desirable, or not important. The results of the questionnaire showed that patients had very high expectations going into a knee replacement surgery. 6 expectations were rated as mandatory by over 90% of patients. These included knee pain, quality of life, physical function, implant longevity, walking distance, and range of motion of the knee. Another 11 expectations were rated as mandatory by at least 75% of patients. These include climbing stairs, mobility, knee stability, physical activities, physical endurance, muscle strength of the leg, general health status, longer standing, daily activities, preventing secondary impairments, and participation in social life. The study also found that patients rated knee-related and general health-related aspects as equally important. The first thing to point out here is that patients have very high expectations going into a knee replacement surgery. 17 of the 31 expectations were marked as mandatory by over 3/4 of patients. But even despite these high expectations, the authors report that at the 1-year follow-up, fulfillment of expectations was better than expected in 40% of patients, exactly as expected in 34% of patients, and lower than expected in 26% of patients. So even though patients went into surgery with high expectations, 75% of them had their expectations met or even exceeded. This is important to point out because knee replacement surgery can be an incredibly effective procedure for many people with advanced arthritis. But it doesn't seem like that's true for everyone. So now let's look at the 26% of people who did not have their expectations met. And we first start with complications. Of the 352 patients, 23 patients, or about 7% of people, had to go back to the operating room. This included washouts for infection, fractures, tendon rupture, and irrigation of hematomas and seromas. Other people needed manipulation under anesthesia for restricted range of motion and persistent stiffness. Unsurprisingly, needing to go back to the operating room would contribute to dissatisfaction. Now let's examine which of the patient expectations were not fulfilled. Take a look at this chart. The left column shows patients who were not fully satisfied with their surgery, while the right column shows patients who report being very satisfied. Pay close attention to where the red bars are located. These are what people marked as expectations not fulfilled. The expectations with the largest red bars include physical function, walking distance, climbing stairs, physical activities, physical endurance, longer standing, and preventing secondary impairments. Pretty much all of these relate to some type of persistent limitation to physical activity or physical function. In fact, when we look at the very satisfied group, their biggest red bars were also in the same categories and include physical function, longer standing, and preventing secondary impairments. The authors write that in general, the not fully satisfied patients were older, had more comorbidities, had worse range of motion post-operatively, and showed significantly lower patient-reported outcome measures. And by the way, if you're enjoying this content so far, please do me a favor and click the like button. By doing so, you will tell YouTube to share the video with more people who may also benefit. Thanks for your support, I really appreciate it. So after reviewing this study, it's apparent that meeting certain expectations is crucial for high patient satisfaction. And depending on how you look at it, surgery does an okay job. 40% of patients had expectations exceeded, and 34% of patients had expectations met. That's 3/4 of patients with positive results. But this is a major procedure, and going in with a 25% chance of being dissatisfied seems really high to me. And I'm not saying it's the technical skills of my surgical colleagues. They really do an amazing job. I think it has more to do with expectations going into surgery. Keep in mind that the expectations that were least likely to be met were those pertaining to knee-related activities and physical function. Patients who felt that knee replacement surgery did not improve these activities reported lower satisfaction levels with the procedure. And because of all of this, there is growing emphasis by physicians to assist patients in establishing realistic expectations about the potential outcomes of surgery. One of these areas is counseling around knee-intensive activities such as climbing stairs, gardening, dancing, squatting, and playing sports. Patients who expect improvements in these areas but do not achieve it are much more likely to report dissatisfaction with the outcome of their surgery. So how can you use the data from this study to help you decide if you would benefit from a knee replacement surgery? I think it all goes back to the results from this chart. Knee pain was found to be the key expectation most successfully achieved in both the satisfied and unsatisfied patient groups. Therefore, if your primary symptom related to arthritis is pain, a knee arthroplasty may be a very effective treatment option to achieve a significant reduction in symptoms. But I have many patients that tell me it's not the pain from the arthritis that bothers them, it's the limitations to physical function and physical activity. These are the people that may seriously want to think about whether a knee replacement surgery is the right option. And this is because the key expectation least likely to be met was related to physical function. This was consistent across both satisfied and unsatisfied patient groups. People who have high expectations for knee-intensive activities are more likely to experience dissatisfaction if those expectations are not met. Of course, every individual has unique circumstances and requirements, and their symptoms will vary. My goal is not to tell you whether you need or don't need a knee replacement surgery. Rather, it's to help provide a framework on how to approach making a decision. Hopefully, you can use this information to start a discussion with your doctors about what kinds of expectations to have with the knee replacement surgery. Lastly, if you decide against surgery, there are many non-surgical treatments that can simultaneously decrease pain and improve function, even for those with stage 4 osteoarthritis of the knee. One of the most overlooked aspects of knee osteoarthritis treatment is the surrounding musculature. Myofascial trigger points in the quadriceps and gastrocnemius contribute significantly to pain and dysfunction. This video will teach you why and how to treat these muscles. Alternatively, this video will go over how a relatively new treatment called platelet-rich plasma injections can help reduce symptoms related to knee osteoarthritis. Thanks for watching, and I'll see you in the next video.